Dr. Shireen Poonawala. I'm a practicing dermatologist and aesthetic dermatologist based out of Pune. I have been practicing in Skin Vibes Clinic located at Pune for past 14 years. So today we are going to discuss a burning topic, eczema. So first we'll understand what is eczema. Eczema is an inflammatory skin condition causing itchiness, dry skin, rashes, scaly patches, and sometimes secondarily it gets infected, which causes blistering of the skin and weeping of the lesion. That is, when pus discharge and yellow discharge you can see coming out of the lesion. So, what are the symptoms of eczema? For every individual, it can vary. It can be something as mild as just plain itching of the skin to something as distressing as a very itchy condition, or something which is like can involve a large area of the body with plaques or the lesions which are thick, scaly. They can be red, inflamed, they are dry, the skin becomes sensitive, they can even be rough, leathery, and the skin can appear scaly, dry climate. Then coming in contact with triggering agents like fur, fragrances, and many other allergens in the environment. Then secondly, it is as I said, the dry weather can be a major trigger because dry skin always triggers eczema. And sometimes emotional triggers like high levels of stress, anxiety, depression can also flare up symptoms of eczema. Is eczema contagious? It's a very, very common question that we come across when people are worried that they may transfer it to their family members, their kids. So no, eczema is not contagious. Is there any cure for eczema? So there is no permanent cure for eczema, but definitely with regular maintenance, with regular skin care, one can achieve remission for long periods of time. So, how do we manage eczema, or how patients can manage eczema on their own? So, number one will be routine skincare. Moisturizing is the primary way to control eczema. So, moisturizing, whether it is summer, winter, monsoon, irrespective, one has to moisturize the skin. Number two, the choice of moisturizer. So, eczema basically happens when the barrier of the skin is lacking. So, the skin becomes more prone to react to the bacteria, which are innate, which are a normal part of our skin. So, basically, to restore the skin barrier will be the first step in the treatment. And this can't be done with moisturizers with just petroleum jelly. So the moisturizing begins from the cleansers, and the number two step will be to be gentle with the skin while drying. Just pat dry and immediately within seconds of having the shower and not letting the skin dry out completely. The moisturizer should be immediately applied all over the skin. This becomes the prime. And whenever there is a flare, avoid self-medication. Keep moisturizing your skin well, and as soon as possible, visit your dermatologist. Then next we come to what are the complications of eczema. So if the eczema is widespread and there has been a lot of scratching of the skin, then they can get secondarily infected. In those cases, there can be weeping of the lesion. Okay, there can be secondary bacterial infection where pus can ooze out. And in those cases, we have to give a short course of antibiotics and some topical antibiotic medication. This was eczema and the various types. Take home message for today's talk would be that eczema is a very, very manageable condition, and avoid commonest mistakes like drying out the skin completely. Okay, don't be very stringent in your skin cleansing per se. It should be done with a mild cleanser and especially it has to be skin pH balanced. So use something recommended by a doctor, use it regularly. Avoid experimenting with products because various products have many allergenic compounds which can trigger a flare in the skin, which can dry out the skin. Follow the basic care for the skin and moisturize, moisturize, and moisturize. So hydrating the skin on a regular basis with the right moisturizer is the key to treat and to keep eczema in remission. Sometimes when it is very severe, they can, I mean, we usually advise to fit in humidifiers because dry environment, dry weather, dry air can also make a person predisposed to getting irritable skin and develop eczema. Number two will be clothing. Clothing, one should avoid very tight fitting clothing with like synthetic, made of synthetic material. We normally advise people to use loose cotton clothes, and cotton and linen fabric is usually very good. Prevent exposure to allergens and irritants. And to conclude, eczema is an inflammatory skin condition. Avoid self medication. Avoid taking medication directly from a pharmacist because they are not qualified in diagnosing the condition and treating it the right way. And follow up with the doctor regularly because treatment is one part, and keeping the disease in remission by taking care in the maintenance phase is again a very, very important part. So, know your disease, know your problem, and learn to handle it carefully. Be responsible for yourself, be responsible for others, and stay safe. Take care. Thank you.